Hello, everyone. Welcome to my case presentation for the Ohio ACC annual meeting in 2021. My name is Sinus and I am a third-year cardiology fellow at Summa Health in Akron, Ohio. Case presentation title is Sinus of Valsalva Aneurysm. Introduction. The sinuses of Valsalva are outpouchings in the aortic root, just distal to the aortic valve that serve several physiologic functions. Sinus of Valsalva aneurysm is a rare pathology that can include a myriad of clinical symptoms and should prompt surgical evaluation for repair. Case presentation. An 80-year-old female presented to the emergency department with a complaint of near syncope. Vital signs and most lab work were unremarkable. A D-dimer was elevated, and a CTA chest was performed. This suggested a filling defect in the left atrium concerning for thrombus or mass. A transthoracic echocardiogram showed an LVEF of 60% with a small left atrium and what appeared to be an extra cardiac mass externally compressing it. A resulting transesophageal echocardiogram showed severe dilatation of the left coronary sinus of Valsalva with associated thrombus formation. The left coronary cusp was moderately restricted. There was no significant aortic regurgitation seen. A cardiac MRI was then performed, which showed a left sinus Valsalva complex pseudoaneurysm, 3.3 centimeters times 4.5 centimeters, with peripheral mural thrombus and central clot. It was located posterior to the aortic root and to the left of the main pulmonary artery, with partial effacement of the superior left atrium as well as lateral displacement of the left atrial appendage. The LVEF was measured at 79%, no wall motion abnormalities were seen, and no aortic regurgitation was seen. A multidisciplinary approach was used. A coronary CT was used to define the anatomy. The coronary arteries were patent without atherosclerotic calcification. The left anterior descending artery was compressed between the left aortic sinus aneurysm and the main pulmonary outflow tract. After continued discussion, she successfully underwent repair of the aneurysm with a bovine pericardial patch and repair of the aortic valve leaflet. Discussion. Sinus of Valsalva aneurysm is an abnormal dilatation of the aortic root. They can be either congenital or acquired. It is thought to occur in 0.09% of the general population. They comprise up to 3.5% of all congenital heart defects and usually affect the right coronary sinus, followed by the non-coronary sinus, and finally the left coronary sinus. Males are 4 times more likely to be affected than females, and there is a higher reported incidence in Asian groups. Non-ruptured sinus of Valsalva aneurysm can be asymptomatic. However, they can lead to arrhythmias, develop thrombosis, which leads to coronary osteocclusion, and can compress near structures if large enough. Non-ruptured sinus of Valsalva aneurysm should be surgically repaired if there is associated significant symptoms. Ruptured sinus of Valsalva aneurysm warrants urgent cardiothoracic surgical evaluation as patients may quickly deteriorate. Medical management of the sinus of Valsalva aneurysm rupture is insufficient for definitive treatment. Medical management should serve as a bridge to help temporarily stabilize patients until surgical or transcatheter definitive therapy is available. In conclusion, sinus of Valsalva aneurysm is a rare anomaly. While non-ruptured can be asymptomatic, they can also be associated with multiple clinical syndromes and symptoms that must be investigated fully for consideration of surgical repair. Ruptured aneurysms should prompt surgical referral. Thank you very much.